morning. What if I dropped a big hairy tarantula down your shirt? Or took you to the top of the Space Needle for a look down? How about if you were stuck in an elevator for hours or even minutes? Would you scream, sweat, or faint? I know when I see a snake, I go weak at the knees, my palms start sweating, I freeze up, I can't move. Phobia is the fear of snakes. How many of you have fears? What are your fears?
Snakes.
Spiders.
Yeah.
Snakes. Wow. Any of us who have an irrational fear, however mild, can be described as a phobia. But what is a phobia? What causes phobias? Are there the different types, symptoms, and treatment options? What is a phobia? Phobia, translated from Greek, means to fear or fright. A phobia is an irrational and excessive fear of an object or situation. In most cases, the phobia involves a sense of endangerment, of fear or harm. Phobia is a learned response. We are not born with phobias. The website About.com updated in 2011, Lisa Pritchard describes phobias as a fear, and she states, "Fear is the most primal and powerful human emotion. According to R. Reed Wilson, PhD spokesman for the American Psychological Association, phobias are the most common mental disorder." He also goes on to state that over their lifetimes, 11% of people will have a phobia. Both these quotes are from MedicineNet.com website posted on January 31st, 2001. The causes of phobia remains unknown. Dr. Tony Whitehead says in his 1983 book, Fears and Phobias, it can be seen that phobias can be explained at different levels, starting with the memory of a traumatic episode and ending with a symbolic significance. There are, however, several theories to phobias. Trauma or life experience, an extremely upsetting experience, such as a person with a phobia of dogs being bitten by a dog. Childhood fears, phobias common in childhood, such as darkness or being lost. Some people can resolve these fears, but some carry on to their adult lives, which therefore are unresolved childhood fears. Biological factors, some phobias are innate. People have innate phobias, such as falling into space and being stared at. These phobias often follow a biological timeline. For example, an infant is frightened by loud noises. At age 3, frightened by strangers, and age 5, by animals. These normal fears strongly suggest biological factors. There are 3 types of phobias. Social phobias, fear of social situations. Agoraphobia, fear of being trapped in an inescapable place or situation. Specific phobias, fear of a specific object, from lightning to snakes. There are 4 different types of specific phobias, which include natural environment, fear of lightning, water, and storms. Animals, fear of snakes, rodents, and spiders. Medical, fear of seeing blood, receiving an injection, or seeing a doctor. Situational, fear of bridges, leaving the home, driving. Some common phobias are arachnophobia, fear of spiders. Social phobias, fear of being evaluated negatively in social situations. Claustrophobia, fear of confined spaces. And panophobia is a fear of everything. Some symptoms of phobias include terror, a persistent and overwhelming fear of an object or situation. Physical symptoms, dizziness, shaking, and nausea. Obsessive thoughts, difficulty thinking about anything other than the fear. Desire to flee, an intense instinct to leave the situation. Anticipation anxiety, persistent worrying about upcoming events that involve the phobic object or situation. In some cases, these symptoms can escalate into a full-scale anxiety attack. As a consequence of these symptoms, some individuals begin to isolate themselves, leading to severe difficulties later in life. As stated before, when I asked Karen Meyer in my interview, I asked her what happens when she sees a spider, and her comment was, "They scare me, and I scream and run away from them. All I can think of is their 8 creepy little legs, and they have 6 or 8 eyes looking at me. I'm always scared they will crawl into bed with me, and I will swallow one." These are common symptoms of phobias. To be able to actually treat a phobia, a person must first understand their phobia. One type is exposure treatment is flooding, in which the patient is confronted by the fear or the object for an extended length of time without the opportunity to escape. The goal of this method is to help the individual face their fear and realize that the fear object will not harm them. An example would be to put me in a room full of snakes with no way to escape. I would truly faint, pass out, I would be done. I strongly do not recommend this type of treatment. But some experts say that this is the best treatment, and if handled correctly, it only has to be done once and the patient is over their phobia. Another method often used in phobia treatment is counter-conditioning. In this method, the person is taught a new response to the fear and object and learns relaxation techniques to replace the anxiety and fear. This new behavior is incompatible with the previous panic response, so the phobic response gradually fades. Counter-conditioning is often used with patients who are unable to handle the exposure treatments, which would be me. Again, with my interview with Karen, I asked her if she'd ever tried to overcome her phobia of spiders, and she said, "Not really. I just try to stay away from them, and I usually get someone else to kill them, like my 7-year-old. Donald Goodwin, MD professor at the University of Kansas, says in his 1983 book, Phobia, "Fortunately, most phobias are benign, and most people eventually recover from them, whether treated or not." Now, I'm not so sure about that, but, okay, he's a doctor, or a professor. Today, we've talked about phobias, what they are, irrational and extensive fear of an object or situation, the cause of phobias, which remain unknown, but we do have several theories about them, 3 different types of phobias, sociophobia, agoraphobia, and specific phobias, the different symptoms of phobias, from terror to anticipation anxiety, and also the different options for treating phobias. So instead of living in fear with your phobia for the rest of your life, instead seek treatment options and get over those phobias. Thank you all.